Hi everyone, we're going to get started now. So welcome to the Human Services and Justice Coordinating Committee Network webinar, reflecting on the past year and looking ahead. Thanks for joining us today. Before we get started, I'm just going to go over a few things. First of all, my name is Tasha, Rennie, and I'm the Network Engagement and Communications Officer for the HSJCC Secretariat. So before we get started, just wanted to let you know that we will have some time for questions at the end of the presentation. If you have any questions, feel free to type them into the chat box and we'll try and answer them all at the end. The webinar will be recorded, so a link to the recording and the PowerPoint presentation will be emailed to all of our audience members at the end of the presentation, and you can also find it on our website. We'll also be sending out a link to an evaluation survey for the webinar, and we'd appreciate it if you could fill that out and give us some feedback. So today's webinar is presented by the HSJCC Secretariat. This includes Szamuhel, our project manager, Christine Conrad, the policy analyst and justice lead for CMHA Ontario, Candace, Vena, the network coordinator, and myself, the network engagement and communications officer. Today's webinar is meant to provide you with a comprehensive overview of the Human Services and Justice Coordinating Committee Network with a look at its history and structure. We're also going to be talking about the relevance of planning and reporting for the HSJCC. And we'll be looking at some of the results from that reporting for the past year. This is going to include some updates on provincial projects as well as highlights from the local and regional committees. And we're going to take a look at what is coming up for us over the next year as well. And finally, at the end, we'll talk a little bit about some ongoing projects relating to member engagement and knowledge exchange. So with that, I'm going to pass it over to Joseph.
Thanks for that introduction, Tasha. Good afternoon, everybody. As Tasha mentioned, my name is Joseph. I'm the project manager for the HSJCC Secretariat. I thought it'd be helpful to begin our conversation today, providing you all with a bit of a glance at the HSJCC network. For those of you new to it or perhaps a little unfamiliar, the network is really sort of a committee of committees. And it was established to coordinate resources and services for people with unique needs who come into contact with the law. And what HSJCCs do across the province at local, regional, and a province-wide level is provide education and training for members of the network, coordinate care for individuals, and work to address systemic issues. And the members of the HSJCC network are professionals from across the human services and justice sectors who are all voluntary and count in upwards of 1,600 members. And I'd like to just take it back a little bit and provide a little bit of context in terms of the history of the HSJCC network. Prior to its establishment in Ontario, there was a recognized need in the province to coordinate resources and services and plan more effectively for people with critical needs who came into conflict with the law. Prior to the establishment of the network, I think there was a real sort of understanding that a lot of professionals from across the human services and justice sectors were working in silos and weren't really working together to affect better outcomes for the clients they were serving who were coming into contact with the justice system. So the initial policy framework for the network was approved in 1997, and that piece of legislation was called the Provincial Strategy to Coordinate Human Services and Criminal Justice Systems in Ontario. And what that piece of legislation did was, again, lay out the sort of framework for the network. And what that framework was essentially 4 partner ministries, with the Ministry of Health and Long-Term Care leading, endorsing and funding the establishment of local and regional coordinating committees, with the provincial committee overseeing and providing support for those committees. And those partner ministries, with the Ministry of Health leading, also included the Ministry of Community Safety and Correctional Services, the Ministry of the Attorney General, and what is now known as the Ministry of Children, Community, and Social Services. And the idea in that framework was that HSJCCs would provide planning tables to bring together service providers to find solutions and develop a model of shared responsibility for dealing with focused populations at their various points of intersection with the justice system. Fast forward to today, and HSJCCs provide their coordination, advocacy, and support in line with current legislation, such as Ontario's Patients First Act, and with a priority consideration for persons with a serious mental illness, developmental disability, acquired brain injury, drug and alcohol addiction, and/or fetal alcohol spectrum disorder. So I spoke about a network of 1,600 voluntary professionals from across the human services and justice sectors making up the network. But I'd like to dive a little deeper into who our HSJCC members actually are. And you can see here that they really do represent all facets of the human services and justice sectors. So around our coordinating committees at the local, regional, and provincial levels, we see municipal and provincial police representatives, lawyers, crowns, duty counsel, and court support workers. We see representatives from probation and parole, representatives from reintegration services and housing providers, healthcare representatives, especially persons involved in forensic services, pharmacies, and local health integration networks, representatives from correctional services, representatives from special population service agencies, specifically dealing with FASD, dual diagnosis, and acquired brain injury, and of course, community mental health and addictions providers. To dive a little deeper into the way that the HSJCC network is actually structured, here we can see a map of where our committees actually function. So again, I spoke of a committee of committees really operating at local, regional, and provincial levels. We have 39 local committees across the province, and their focus is more on sort of specific education and training in their local areas and care coordination for individuals at the pre-charge, and post-charge process points, during court processes, and involved around release planning. When we look at our regional HSJCCs, we're sort of upscaling the coordination aspect. So we have 14 regional HSJCCs in operation. They look at education and training as well, but look at issues from a more regional system change perspective and really focus on initiatives around sort of that specific topic. Provincially, we have a provincial HSJCC, which also provides education and training for its members, but looks at province-wide policy projects and system change initiatives. In terms of funding, local and regional HSJCCs receive their funding from their local health integration networks through transfer payment agencies, and the provincial HSJCC receives its funding directly from the Ministry of Health via its transfer payment agency, which is CMHA Ontario. Also wanted to take a little time to dig a little deeper into the role of the provincial HSJCC. Now, I spoke about how local and regional HSJCCs are really focused on education for their members and sort of local and regional specific service issues. Well, the provincial HSJCC functions a little differently in that it tries to provide administrative and facilitative support for individual HSJCCs and the collective efforts of the network as a whole. But it also identifies provincial service and policy issues and makes recommendations to address such issues to appropriate governments and other bodies determined by the nature of those issues. It also identifies solutions to systemic problems and tries to promote consistency of approaches across Ontario while recognizing regional diversity. It also has a significant role in terms of knowledge transfer in that it tries to share information across the HSJCC network and beyond. And in order to facilitate that role, the HSJCC Secretariat was created in 2015. And the Secretariat really tries to sort of, facilitate the work of the provincial HSJCC, support that larger HSJCC network infrastructure, and really sort of carry out the work plan for the provincial HSJCC, which will be a focus of this webinar a little later on. And currently, the HSJCC Secretariat are housed in CMHA, Ontario. So with that little glance at the HSJCC network and our various structures, I'm going to turn it over to Candace.
Great. Thank you, Joseph, so much for that introduction and comprehensive overview of the network. As mentioned, we were going to be reviewing some of the exciting and impactful work that has been done over the past year in the network. But to preface that, I'd like to talk a little bit first about how we get to this point, meaning how do HSJCCs plan their work for the year ahead, and subsequently, how do we report and evaluate the work once it's been completed? So as the Ministry of Health and Long-Term Care is the primary funding source for the provincial HSJCC, parameters for reporting were first set in place by the Mental Health and Addictions Branch in 2015. And this reporting mechanism really illustrates how the work of the HSJCC network aligns with their mental health and addiction strategy. It's also really helpful for the HSJCCs to use this tool to efficiently plan and evaluate their work. So this reporting process is completed twice a year, and it's done using a standardized template. And this template really maintains consistent accountability for structures at the local, regional, and provincial HSJCCs. This also aids the Secretariat in identifying what the priorities are of the network and how we support the provincial table in addressing these priorities. So in March, that is when work plans are due for all of the HSJCCs. They will clearly outline what their anticipated activities are for the next year, outlining the outputs and the outcomes and the anticipated budget. In June, this is the second part of the process where HSJCCs will then report back on the work from the previous fiscal year with their actual outputs, outcomes, and budget. So the regional and local HSJCCs will submit their plans to the Secretariat for review, and the Secretariat will collate the provincial, regional, and local work plans and reports and send them directly to the Mental Health and Addictions Branch, as well as to the 14 local health integration networks, as the LHINs do provide funding to the local and regional HSJCCs. On the next slide here, you'll just see an example of a completed regional annual report for 2017 to 2018. So under activities, the HSJCCs will clearly outline what the activity is going to be and what system support function it falls under. So the two examples here are training and professional development and collaboration and collaborative care, with a little brief description under what that activity is going to be. In the next column, you'll fill out what is actually going to be produced or delivered resulting from the activities, and as well as the outcomes. So what are actually the regional or community effects, then the changes that occur as a result of this. Really importantly, in the next column is the mental health and addiction pillars that each activity contributes to. So each activity needs to be mapped out to one of those as outlined by the Ministry of Health, Mental Health and Addiction Strategy. They'll put an anticipated timeline that they'll complete this activity or project, and then of course their anticipated budget for that year. And then, as I mentioned, in June, this is the second part of the template that'll be filled out from the year before, which actually reports on what were their actual outputs on each activity, their outcomes, and the actual budget. Okay, so I'll segue now into talking about some of the work that was done at the provincial level last year. So the provincial table met 5 times in Toronto, and during the year we had 3 issue management sessions. So these issue management sessions are really to discuss some of the systemic issues and potential and identify potential solutions for these challenges. Some of the sessions included discussing the key issues faced by Indigenous populations in the justice system, some key issues that are being faced by aging populations who have mental health and addiction issues who also interact with the justice system. And finally, we had an issue management session on looking at the results of the provincial election and really what the impact of these results were going to be on the work of the HSJCC network as we move forward with the new government. Under our communications and knowledge exchange, we provided 6 HSJCC network newsletters last year. So the Secretariat works on those and releases them out to our mailing list, as well as we hosted 7 educational webinars, which are all available on our website. A really important project that we released last year was the development and dissemination of our network member engagement plan, which strives to improve engagement of members throughout the network. And I won't go into too much more detail about that, as Tasha will be talking about it more in depth later on in this webinar. And then finally, the provincial HSJCC hosted our network conference in Toronto in November of last year. This conference was themed the Walking the Path, Finding the Way to Wellness, and it featured over 38 presentations and workshops, which can also be found on the website if anyone's interested. So the provincial committee continues to be engaged with all of our health and justice partner ministries through informative presentations and discussions. This year, the committee was given the opportunity to hear various presentations from some province-wide initiatives, which included presentations from the Ministry of Health and Long-Term Care, specifically in their mental health and addictions branch on their mental health and addiction strategy. The Ministry of the Attorney General also provided presentations and shared updates on their Community Justice Center Initiative pilot project. And finally, we heard presentations and updates from the Ministry of Community Safety and Correctional Services, specifically on the Discharge from Distant Court Protocol project. Aside from our ministry presentations, we also had a number of educational presentations from our key stakeholders. So the table did hear from Legal Aid Ontario on their new prison law strategy. We, in January, had a presentation from the Alzheimer's Society, as well as another presentation from CMHA Waterloo Wellington on aging populations who have frontal lobe dementia who interact with the justice system. We heard from Dr. Michaela Bader on immigration detention and how this impacts the mental health of its detainees. And finally, CAMH's Provincial System Support Program presented on engaging with Indigenous populations and forming meaningful partnerships. Okay, so moving on to our provincial projects. This year, the provincial HSJCC completed its mental health court project. Just to give you a little bit of background information on this work, there was little to no understanding of the structure and function of mental health courts across the province. And as such, supported by a working group, the provincial table began a project interviewing individuals who support mental health courts across Ontario. And the purpose of this was really to increase the understanding of how these courts are formed and how they operate. This was actually the first comprehensive scan and collection of information on mental health courts in the province, so it was a really exciting project. And results from the data collection and analysis revealed that there is actually 19 mental health courts in Ontario. After this stage, there was also a mental health court forum convened where professionals working in the courts came together to discuss the findings of this project in April of 2017. And finally, a full report and webinar released to the network in November of 2017. Okay, so the provincial table also began the Indigenous Populations and Justice System project this past year. And the objective of this project was really to identify key issues facing Indigenous populations in the human services and justice sectors, and to really increase the inclusion of Indigenous perspectives in all of our the HSJCC's work. Last summer, a survey was conducted to see how local and regional HSJCCs are engaging with Indigenous populations. The results of this project were shared with the provincial table. And lastly, the provincial HSJCC also began its work on the Discharge from Distant Court Protocol project, formerly known as the Red Bag Program. The objective of this project was really to improve experiences and outcomes for justice-involved Ontarians by guaranteeing the provision of their belongings upon discharge from correctional facilities. The provincial table engaged in several policy consultations with the Ministry of Community Safety and Correctional Services on a plan to really spread and scale up this program throughout Ontario to other correctional facilities. Okay, so now I'd like to talk a little bit more about some highlights from the regional and local committees last year. they engage in a number of activities that really strengthen system support functions and direct services that are in alignment with the Ministry of Health's mental health and addiction strategy. These activities included a number of knowledge translation and exchange activities, increasing member engagement within their own committees and with other committees in the region, providing training and professional development opportunities, partnering with key stakeholders to increase cross-sectoral collaboration, and finally, performing a review of system services to improve the coordination of services for individuals involved in the justice system. So next, I'd like to go over some specific examples. And of course, this is just a snapshot of some of the great work that was done last year by our regional and local committees. So Champlain Regional HSJCC held a community engagement event, and this was in recognition of their Youth Mental Health Court 10th anniversary. This event really brought together young people and community partners to create a greater awareness of some community supports available for youth, and it really increased relationship building with professionals in the community. The Northwest Center of Responsibility, which was formerly known as the Northwest Regional HSJCC, went through some changes in their structure. So they now incorporate principles of situation tables and hub models into their structure. Situation tables that were recently mobilized are now operational in the District of Thunder Bay, and they actually provide updates to the Northwest Center of Responsibilities table at their meetings. Over 200 people participated in some online and as well as some in-person situation table training sessions last year. For Waterloo Wellington Regional HSJCC, they created and distributed a crystal methamphetamine harm reduction booklet with a follow-up to explore the development of an online format so they could target some youth and other users. The committee used this new knowledge to improve existing practices and really provide some harm reduction assistance. So some 3 examples from the local HSJCCs. As a direct service, the Barrie local HSJCC allocated funds to be able to purchase kits and gather useful items to give to young people at risk of homelessness, human trafficking, and distributing them at their youth haven shelter. And a bunch of their other local HSJCCs in the Simcoe-Muskoka area did similar projects to this. In Hamilton, the local HSJCC collaborated with the Hamilton Police Service on their mobile crisis rapid response team development, which really took off. There now are permanent protocols in place, and it is a permanent program in Hamilton and is spreading across the LHIN. In terms of Toronto and their local HSJCCs, they really provided a forum for data and information sharing through educational presentations. So they were circulating webinars from their local HSJCCs to the network. Some examples are Keeping Sane in an Insane World, Cannabis, and their mobile crisis intervention teams. And Toronto also really focused on reviewing their lunch and learn evaluations and feedback for continued improvement in evidence-based decision making. And with that, I'm going to hand it back over to Joseph to talk a little bit about the year ahead.
Thanks, Candace. So, as members of the HSJCC Secretariat, we're in a lucky position to really know what's going on across the network for the next couple of years. And there's a lot of exciting work going on. For the provincial HSJCC specifically, what we're going to be focusing on in the fall is determining our work plan for the next 3 fiscal years. So we're currently coming to the end of our 3-year work plan cycle, and certainly Candace has touched on some of the achievements from that work plan cycle. But we'd really like to look ahead and consult with the entire network to determine what our priorities as a network and as a provincial HSJCC should be. Obviously, we have access to a lot of expertise and certainly relationships to affect really positive systemic change for our client populations and their intersections with the justice system. So we'll be in the fall consulting with the regional and local HSJCCs and all of our sort of partners to really determine what they'd like us to focus on. And again, the objective is to really make sure that the provincial HSJCC and what it's working on is really aligned with the challenges and emerging issues faced by all of our committees, and all of our partners. And so we will be reaching out to everyone across the network in the fall in order to, again, gauge what their priorities are and how that should inform our work plan for the next 3 years. So please stay tuned for that communications. We really look forward to sort of engaging with all of our stakeholders to make sure that our work plan for the next 3 years is as effective as it can be.
Thank you, Joseph. This is Christine speaking, and I'll just be discussing some of the projects we'll be working on in the year ahead. The first one, older adults in the justice system. Candace mentioned this briefly. It was first identified as a key item of interest by the HSJCC Network in 2015 and was then added as a project to our provincial work plan. The objectives are to identify key issues impacting aging populations who come into contact with the justice system, to generate solutions, and to create a navigational guidebook in 2018-19. Our project advisory committee met for the first time on July 19th of this year. Our committee members all have experience working with older adults that are involved in the justice system and include representatives from across the human services and justice sectors. At this first meeting, the committee reviewed and finalized our project charter and determined next steps, and we'll be meeting next in the early fall. Our Indigenous populations in the justice system was first identified as a provincial project in 2016-17. Its objective is to inform the HSJCC network of key issues facing Indigenous populations in the human services and justice sectors and contribute to better related policy outcomes. The provincial table is currently pursuing opportunities to engage with Indigenous populations through knowledge sharing, for example, through webinars and presentations with our provincial ministry partners. Representatives from the HSJCC network attended an Indigenous Peoples Court conference at the Mississaugas of the New Credit First Nation in July, and an Indigenous keynote speaker will be invited to speak at the provincial HSJCC conference, which will be held in November of 2019. HSJCC members are also involved with EENet Communities of Interest, or COIs. So EENet is a knowledge exchange network that helps create and share evidence to build a better mental health and substance use system in Ontario. It's located in the Provincial Systems Support Program at the Centre for Addiction and Mental Health, CAMH. The communities of interest bring together individuals who are interested in a common problem to develop and share new knowledge that will help improve understanding and enable action. The Health, Housing, and Justice Community of Interest is releasing a report on the challenges and opportunities in stabilizing housing and mental health across the justice sector in fall of 2018, and a webinar will be released to promote that report in the fall as well. HSJCC members also sit on the Racialized Populations and Mental Health and Addictions Community of Interest. Their report on criminal court diversion programs and practices and how racialized populations are being served will be released in winter 2019. A webinar and/or think tank may also promote this report. And this COI has been invited to present at the provincial HSJCC conference in 2019 as well. Finally, the provincial table is involved in ongoing policy consultations and submissions. So we will continue to engage with our provincial ministry partners in line with our policy priorities on issues affecting the human services and justice sectors.
Great, thanks, Christine. So one of the big projects for the provincial HSJCC has been their biennial conference. So every 2 years, this event brings together professionals from human services and justice sectors. And this is a huge knowledge exchange opportunity. It brings people together to connect, learn, and share best practices. So in 2017, we had a conference that was titled Walking the Path, Finding the Way to Wellness. And it was attended by over 400 participants and featured around 38 presentations and workshops. Our next conference is going to be in November of 2019, and planning is already underway. So calls for abstracts will go out probably in early next year, so keep an eye out for that. And so now we're going to talk a bit about member engagement. This has been another big area of focus for us over the past year.
As a network of volunteer professionals, it's very important for us to ensure that our members are actively engaged at every level. So the purpose of this project has been to improve engagement of our 1,500 plus members of the local, regional, and provincial committees. In November, the provincial HSJCC launched this plan, and the goals of this project are to improve participation of the local, regional, and provincial committee members, enhance communication and collaboration of local, regional HSJCCs with one another, improve the flow of information between provincial and regional and local committees, and recruit new members to the network. So this project began in 2015 and has been guided by the provincial HSJCC's project advisory group. During that time, an online survey was used to consult with chairs of local and regional committees to get a better understanding of current engagement issues. That survey showed that overall the network has an above average engagement levels. However, there were a number of challenges that chairs reported when it comes to engaging their members. Some of these challenges are things like time commitments and schedule conflicts. A lot of committees also reported issues with having their own clear direction and goals and objectives unique to their own committees. There's also issues with lack of willingness to take on roles of responsibility, such as the chairs and co-chairs of the committees. There's less representation from the justice sector, and also a lack of understanding about the HSJCC network as a whole and how their own individual committees fit within that network. And finally, there's a lack of awareness about how the provincial committee operates and the relationship between the local, regional, and provincial committees. And so a large part of our work in implementing this plan has involved promoting awareness about the network, about the work of the Secretariat and the provincial committee, and the resources and support that are available at the provincial level. So the member engagement plan was developed to address some of these challenges, and a document was released last fall, which included a number of strategies grouped around 4 guiding principles, which are vision, motivation, communication, and knowledge exchange. So while the strategies that we have suggested might not be applicable to every committee, we do suggest that committees take the time to discuss each of these aspects of engagement. So the questions on this slide are really great examples of how to jumpstart these types of conversations. We really think that taking the time to reflect on what's working and what isn't is a really good way to begin collectively developing strategies that are tailored for each committee's unique needs. Since this project was launched, we've had the opportunity to connect with the local and regional committees. I've had a lot of conversations with chairs and co-chairs from these committees. The Secretariat has been able to visit several committees and facilitate discussions, and we've even held an event, a longer engagement event to really dig into this issue and help committees come up with some strategies. So we've heard a lot of really interesting feedback, and we're happy to continue working with committees to work on these strategies and continue improving engagement issues that they're having. So knowledge exchange is another really important aspect of the HSJCC's cross-sectoral collaborative work. Knowledge exchange involves closing the gap between knowledge and practice and connecting the people who create knowledge with the practitioners and decision makers who can turn it into action. So the HSJCC Network has its own Communications and Knowledge Exchange Committee, and they oversee our CKE activities for the network and support the KE activities of the local and regional committees. So the CKE committee oversees things like our monthly webinars, our bi-monthly newsletter, social media, and our website. And over the past year, we've also been working on developing a knowledge exchange guide. So this is meant to support local and regional committees in their knowledge exchange activities, and it's a guide that contains more information about what knowledge exchange is, and as well as resources for better planning and evaluating knowledge exchange strategies. So as you mentioned, there are a lot of really great tools for improving knowledge exchange and communication within this network that already exist at the provincial level. So we'd like to encourage all of our committee members to continue using them. One such tool is the HSJCC website, which is a really good resource for the network. It's a place where you can find updates on provincial projects, an archive of our newsletters, webinars, events, and a very extensive document resource library. Each local and regional committee also has its own webpage where they can upload information about their committee as well as documentation to do with committee business. And we encourage committees to really make use of this resource, in particular as a way to archive their own documentation. This can be especially helpful if there's a lot of turnover within a committee, so that things like templates don't get lost in that transition. So the Secretariat currently manages this website and is happy to help upload any committee documentation, so feel free to contact us about that. One of our other resources is our HSJCC newsletter, which goes out every 2 months and always contains a number of updates for the provincial committee as well as local and regional updates. Information on upcoming events, webinars, and partner ministry and partner stakeholder news. We also manage a mailing list for the full network, and so that's the best way that you can find out about upcoming projects, events, webinars. So if you are not a part of the mailing list, or if your committee members are not on our mailing list, we really encourage you to visit our website or contact us to make sure that you're on there. So I think that pretty much covers it. We just really wanted to emphasize that there is a huge wealth of knowledge, expertise, and innovative thinking within this network, and we really encourage our members to help us share it, not just within the network, but also in the community at large. So you can see all of our contact information up here. Please feel free to get in touch with us if you have any questions or want to further discuss any of the things that we've covered. You can also find some information about our website and online social media presence, Vimeo, on this slide here. So we have some time now for questions. If anyone has any questions, please feel free to type them into the chat box. We'll just give you a couple minutes to get those in, and we'll get to them right away. Okay, so we have one question about what policy submissions HSJCC has made in the past.
Certainly. So I think Candace touched on the fact that at pretty much every provincial HSJCC meeting, we do have government from our representative ministries come to present on some sort of initiative that they're working on. That gives our committee, the provincial committee, a very real and immediate lever on government. So they provide their feedback, and that is informed by their experiences within the network or their partner organizations. So that's one means by which the provincial HSJCC and the network at large sort of interacts with government and provides their feedback. Moreover, specific submissions that have occurred in the past year were a submission around the province's opioid strategy, as well as a submission on their corrections reform legislation, which also took place over the past couple of years. So certainly, consultations and submissions with government are very live things that are ongoing, and we certainly look forward to continuing that relationship with the new government.
Okay, great. There are a few questions about the PowerPoint presentation, so just to let you know, it will be available on our website afterwards, as well as a link to the recording of the webinar, and that will all be sent out to all of the participants as well. So there was another question on here about, sorry, one second. Says, we listed a number of professionals and organizations as members, but not persons with lived experience. Are lived experience members not regularly used on committees?
Certainly, the need to consult with persons with lived experience is a very prevalent concern of all of our committees. We have that representation at the provincial level, and certainly a lot of regional and local committees have that representation as well. There's no sort of province-wide directive for that. We really do leave it to our network to determine, the processes by which they engage with persons with lived experience, but certainly that's a fundamental understanding across the network of the need for that input.
Great. Okay. I think that is all of the questions. Unless there's anything else, please feel free to type it in right now. All right. Thank you so much, everyone, for joining us today. Again, please feel free to get in contact with us with any questions, and all of this will be available on our website. Thank you very much, and have a great afternoon.